Next, I'm going to invite our facilitators for our panel discussion. I'm going to bring Dr. Davide Matino back up here, who you've already met. And I'd also like to introduce Elia Fong. She's a physiotherapist from Edmonton and practices at the Stollery Children's Hospital. She's been working with the bleeding disorder population for 15 years now. She has a keen interest in working with chronic conditions and particularly focuses on how chronic conditions impact the patient and their family's quality of life, physical health, and social-emotional well-being. Welcome, Elia. And I'll have Dr. Matino and Elia bring up our panelists. Thanks.
And I'm actually going to read their bios. All right. So we will have CLEAVEN PAGANI come to the podium. So he's the co-president of the Alberta chapter and a member of the National Board Blood Safety and Supply Committee. Oh, there he is. Great. ALISA HILDEBRAND, who is a parent of a 10-year-old boy who has severe hemophilia A. He was diagnosed at 9 months old when his arms swelled after having blood work done. From that time until he was almost 5, he suffered from many ankle joint bleeds. He also had to have a port put in at age 3 due to poor vein access. Since starting Hemlibra when he was almost 5, he hasn't had a significant ankle joint bleed. Stephen Brown from Ontario. Stephen has been navigating life with hemophilia B since birth and brings a valuable perspective to the discussion. 5 years ago, he joined a gene therapy trial, which has been a game changer in his treatment journey. With a PhD in molecular biology and over 15 years of experience in market access and reimbursement within the pharma and biotech industries, Stephen offers a unique perspective on the transformative impact of gene therapy in hemophilia. DANE PEDERSON is a hemophiliac with severe factor VIII deficiency and has experienced every form of hemophiliac treatment since cryo. Dane lives with his wife and 2 children in Dundas, Ontario. His daughter was recently tested as a symptomatic carrier. And finally, Robert McDONALD. Robert is 45 years old and was diagnosed at birth with hemophilia A. With severe hemophilia A. He lives in Kitchener, Ontario, about 1 hour west of Toronto. He's the plant manager for a manufacturing company, and hobbies include martial arts, motorcycles, and racing. That sounds really fun. He's been on I'm not even going to pronounce it, Martusiscom, I'll let somebody else pronounce that, study trial for a little over 2 years now, and only required factor VIII infusion once since then. So thank you everyone for being here, and I will turn it over to Elia and Dr. Matino.
Okay, well, thank you everyone. Thank you for being here this afternoon and for sharing with us some of your experiences, and maybe we can also have some time for questions and discussion. I know like 2/3 of you very well, but maybe we can start with, you all had some direct experience with these novel agents in one way or another, and maybe it would be nice to hear from all of you, and maybe we could start with a very brief introduction and maybe why you decided to use a specific therapy or why you enrolled in a specific trial, and then we can go into a little bit more detail with some questions or discussion, okay? Rob, maybe you can start.
Sure. Hello, everyone. I started the study trial of marstacimab. Close enough, maybe.
Himpavzi, I don't know if it's easier.
Or Himpavzi, yeah. A little over 2 years ago. No bleeds during the entire time, other than 1 month ago, where I was doing very physical work, heavy load, and twisting, and ended up with a muscle bleed in my forearm. Other than that, it's been a great experience for me. I wanted to contribute to seeing the development of new therapies, new technologies, the innovations to help the next generation of hemophiliacs. So that's really why I took part in the study to begin with. And then that just came with the benefit of doing a once-a-week subcutaneous versus multiple times a week intravenous, which over the years I wasn't the greatest at keeping up with. So this one's very easy, and I don't think I've missed one So,
And the benefit of seeing us very often.
Yes,
after you started is
exactly.
okay. Please.
Yeah, so I was on the panel 2 years ago at the last Rendez-vous and presented my 1-year experience of being on Hemlibra. And I guess I'm here now to present my 3-year experience of being on it. So I have had a couple of bleeds while being on. They've been mostly either traumatic or I've had a couple muscle bleeds. So I was really relating to what was being just presented before about the muscle bleeds from doing activity. And I will say my activity hasn't changed at all. I was active before and I'm active now. I still do the same sports. But doing things like mountain biking and curling, I always thought were pretty low impact, maybe moderate impact. But now I'm getting bleeds in my quads or other muscle bleeds where I was getting no muscle bleeds before. So that's something that I'm now being aware of. Maybe I'm just getting older. Turned 40 last year. Maybe that has something to do with it. Maybe I need to stretch more before doing it now. But that's for me what I've been noticing being on Hemlibra.
Thank you.
Hi, my name is ALISA. Our son is 10 years old, and we ended up being offered, he was one of the first in Manitoba to be offered to be put on Hemlibra. And the reason was his early years were quite difficult and traumatic. He was at first on once a week prophylactic treatment with factor treatment. It very soon increased to 3 times a week, but he had a target ankle joint, and he got continual bleeds in it. He spent most of his first 5 years in either casts, braces. He didn't get to be an active kind of preschooler, and so we knew that we weighed out the options of the risks of him trying a new medication that was newer to Canada, or him continuing, and we thought that it was worth the risk of trying this. The studies have been done in the US, but not as many done in Canada yet. But we thought that it was definitely worth the risk because we wanted him to have that opportunity to have a normal childhood. And since being on Hemlibra, it has been quite a change. He started out on once a week subcutaneous. Before that, it was 4 times a week and still getting ankle joint bleeds, as well as he had difficult vein access, so he had a port put in. So now he's been 5 years that we know of. He hasn't had a major bleed. We've had some suspected injuries, but we're incredibly thankful that he hasn't had a major bleed since then. So.
Thank you.
My name's Stephen. 5 years ago, a little over 5 years ago, I enrolled in gene therapy trial with Dr. Matino. I will preface, though, it was the Pfizer gene therapy, which is no longer going to be offered, so take that with the caveat it is. Over the 5 years, I have had breakthrough bleeding. My levels are variable depending on who you believe, but it's put me into probably a very solid, mild category. And there's a lot of talk, and Karen's previous talk before about, it's been a little bit of a transition. The bleeds I've had, 100%, I knew they were bleeds. It's the other aches and pains that I'm not sure I may have missed some bleeding where I thought, again, if I rested and they resolved on their own. I will say, though, my activity, I'm not on prophylaxis anymore, but I work out every day, have put a lot of muscle on joints that previously I was looking at replacements for. So in that time, I feel like my health has drastically improved. And while I think it's fair to say that gene therapy isn't going to restore joint damage, we all know that, I think it's definitely slowed the progression and allowed me to do some of that activity that is protective for it.
My sort of transition into like the long-lasting Altuvio really stemmed from an adolescence of not treating regularly, of being an on-demand hemophiliac that, knew everything, and then transitioned into my 30s where I realized I can't do this. I need to be doing a prophylactic treatment. I need to be more responsible. And that led into like the medications that were available for long-lasting infusions, getting that trough life and lessened, and so that you could have more coverage. And I, as a willing participant, I will take any options that are available, and worked with the clinic with going through a study, and into Altuvio, which was remarkable. And now I haven't had a bleed. I can't even remember the last time I've had a bleed. It's been probably 4 years on the study, and I'm transitioning into this world of sort of dealing with being a hemophiliac without being a hemophiliac. Like, I have the vestiges in my ankles, I have the elbow, I have all these things that that are those reminders of being a hemophiliac, but I don't have to deal with those bleeds. And it's been a whole mind bend to be like, oh wow, this is just a bad ankle. And yes, and that's where I find myself today.
Thank you. Wonderful.
As I was like preparing so many questions, you guys just highlight everything what I wanted to ask, and it sounds like your quality of life has improved drastically. I do have some specific questions. I'm going to ask a parenting question just because I parent myself. I can imagine having children or a child that has a chronic disease management. There's other burden that comes with it, and there's I think someone mentioned earlier that parenting style, a lot of guilt from social media, a lot of shaming between parents. I totally understand when some of the parents that I meet in clinic end up helicoptering. It's not to be terrible parents, it's because they care and they love their children. And I'm just wondering, do you feel like you were able to change a different type of parenting style now with your child being on Hemlibra? If you can speak to that.
Definitely able to let him do more than he did before. Have a little bit more freedom to do more now than he did before, and let him now. I think both my husband and I say, okay, try it. We're going to see what happens. If you end up having an incident, at some point we realize that you may need factor from it, but that we want him to be able to try things and be a normal child, teen, and be able to try doing things now. So probably a little less protective now than we were before, for sure.
Would you say the word no is a lot less now in your?
Definitely a lot less.
Okay.
Maybe, I don't know, I was just going to ask, even for the others, I don't know, have you changed your, if for those of you that have children, to deal with your children or your parenting style after, switching to the new therapy? Have you noticed any difference, or have you changed anything in this aspect of your life, or your family life?
I can go. I mean, that was one of my considerations for doing the gene therapy. I do have a 12-year-old son. At the time, he was 7, very active boy. And it was one of the things that I wanted to, as I got older, to make sure that I still had the mobility to keep up with him and be able to do the things that, he wanted to do and not be the limitation. So in that regard, it has changed the way that I have interacted with him.
Yeah, I think with children, you really take that into consideration as you get older. And I wish I had the hindsight. I wish I could talk like an old man, but I will. The hindsight of looking back in my 20s and saying, what could you have done differently? What could you have mitigated now so that you could do the things? You can run after your kids, you can participate with them and other things, but also there's the random things that happen. Like, I coach baseball for my kids, and I've been hit by a ball. Now, albeit it was an 8-year-old, but it was hard. And luckily there was no bleed. So
superior efficacy of Altuvio. It's a case of
I test it all the time.
An 8-year-old, it's a big guy, and
I make sure that it's doing what it needs to do.
Thank you, Dave.
Anyone else want to speak to about how parenting changed? I can move on to the next one. Okay, so obviously changed a lot of your life. I'm just wondering, when you guys went to these novel therapy, what's your view on the future? Just because I work with another condition, which now these kids who plan for their life to be so short, they're like, oh no, I actually have to plan for my life to be like this into the 80s now. I'm just kind of curious, like, has your plans for the future changed, and how did that change?
I would say just more optimism, being born in the 70s and, starting off with cryoprecipitate and then moving on to the different treatments. There seemed to be maybe a 15 to 20 year period where there didn't really seem to be, or at least from my side, much innovation or change in treatment or care. But the last 10 years has been incredible. It's very, very exciting from where I sit. And so just, again, optimistic for the future that things are going to continue getting better. After hearing Karen's presentation there, taking a different look at, what might be the origins of joint bleeds. It's an exciting time. So very, very optimistic for the future.
I'd like to echo what you just said, but also add, I definitely am very thankful for everything for the advancements that have been made so far, but it's still not perfect. And my idea of thinking about the future is I still want to see what's coming next. We do know that those subclinical bleeds are happening, and it's just, the problem hasn't been solved yet. So I'm optimistic for the future, and I can't wait for the next generation of treatments to be coming out.
In terms of the future, I was actually very thankful today about aging with hemophilia, because I think, being born in the 70s too, not that I ever thought I was going to die young. It was never thought about growing old either. And I turned 50 this year. And I have to say, while hemophilia is still on my mind, in terms of my medical interactions, it's low on the list now. Now I'm dealing with old people problem, cardiovascular health. And, it's one of those things that, how is the risk of heart attacks and strokes balanced with, a bleeding disorder, and how is that going to play out? And it's just one of those things that I am very thankful for the gene therapy. But, Dr. Matino, curative, I would probably call it the extra long-lasting factor treatment. But it's true. It's what else is going to happen. My joints aren't going to continue to improve. But at the same time, being physically active is an important thing as you grow older. It's one of the number one things you can do to make sure that you live a long life. So it's just sort of the next phase, and I'm happy that it's being talked about.
Yeah, hemophilia is so generational. In my family, there's no family history of hemophilia that we know of. My mom comes from Portugal, so who knows what might have happened on the islands, but they don't think that there was a hemophilic history there. But my daughter's a carrier, and that now is part of my world. It's crazy that all these advancements are being made, and if she has a kid, there's all this bright future for them.
And does it work? Yeah. Okay. So while you were talking, I was thinking that you were all either involved in a clinical trial or early adopters of a new technology, right? And of course, I think we are all very thankful that you were willing to participate in these trials, because it's also because of you that we now have these products approved. If patients don't participate, we would never have this progress in the therapy. But what I wanted to ask you is, would you now, after a year, 2, 3 maybe of experience, right? And with the current knowledge, would you do that again? And if so, why? And or if not, maybe you can also tell us why not. What was your experience and why? And if you think that you would do the same experience again, if you think that this was worth it, and maybe it could also, be helpful for others that are considering maybe using a new therapy or participating in a clinical trial. That of course for us, for the community, is incredibly important, but for you is also a burden in a way. It's a commitment, right? So maybe you can give us a little bit of your thoughts on this.
Yeah, I'd definitely do it again. I don't think you make any change and any progress at anything in this world without people that are willing to ask questions and take chances and explore. So again, if not me or any of the other people that have been involved, then who's going to do it? So I almost felt it was a little bit of an obligation.
That's
I really did.
We did a good job. Kate, where are you?
He's on the flight. There's the camera. Yeah, Karen's on the airplane now.
No, Kate.
Okay, Kate's right there.
Oh, there. Okay. Good job, Kate.
But yeah, I mean, again, going through the whole tainted blood issues that we had in the 80s, and just seeing again the quiet period of time when nothing really changed. And as you get older, I think you start to view things in a different way. And I started to think more, well, what could I do to help future generations? So yeah, I would have no reservations about trying something new. I encourage others that might be questioning it. There's a lot of success, and it is a game changer from my perspective. Being able to go to this type of a treatment as opposed to the prophylaxis of intravenous. So yeah, go for it. What else can you say? I get it. People are going to be nervous and sort of concerned about, what are the implications. But I think that you guys have got all the data to support how beneficial it is. And yeah, I would encourage people to give it a try.
I would echo that as well. Like as a parent, life before Hemlibra and life after, you can't compare it. Substantially different. Our son's first 5 years compared to second 5 years were a world of difference for him and for our whole family. It was worth being willing to try something new, and it's made a huge difference for him.
Yeah, I think Altuvio was the easiest transition as sort of giving myself infusions since I was a child to transitioning to once a week was almost an easy way to go. I went from twice a week to once a week. So out of all of them, it's the easiest to say, yeah, of course I would do this, because it was the most smoothest transition that there could have been.
I'll answer the question, and it was not an easy decision for me. Gene therapy, I weighed very heavily. It's a once and done. You can't take it back, and you don't have the option again. So, I will tell you how I made my decision. The question of would I do it again and all of that, I probably would. The landscape has changed in the last 5 years too. So, the decision making would be a little different. First of all, I have a PhD in molecular biology, so there was just a coolness factor. I grew up and was trained in molecular biology with gene therapy coming, and I always knew factor VIII would probably be one of the very first poster childs because of the way it is. I do feel an obligation that, there were a lot of hemophiliacs before me, the tainted blood, who advocated and got us where we are today. The least I could do is to help continue on, the betterment for the community. As well as I'm also in market access and reimbursement. Every day I use trial data to try to get drugs to market. And who am I to feel a little hypocritical to say I wouldn't do that for myself and for my community, but I'm willing to use that and for my job. So that was sort of my decision making. I it was challenging. The clinical trial, I mean, it's not fun. It was a lot of blood work. My poor veins couldn't take the blood work. It was also during COVID, which was a unique experience. That's for sure, meeting Dr. Matino with security, being led into hospitals for my visits. But I do think I would probably make it today, the same decision. But like I said, it would be a different conversation because of the new treatments that are on the landscape.
Thank you.
Yeah, I'd just like to add, I wasn't an early adopter, but I have 2 daughters that are affected, and I think I would be now, just thinking about my grandchildren and how that might affect them. I definitely would consider doing a trial in the future.
Thank you.
How much time do we have left?
Yes, go ahead.
Okay.
Yeah.
Just looking back to the previous session where they were talking about mental health, I was wondering if you guys can speak to how these products that you were on, or even being on a study, how that changed your mental health or your mental burden, if any, as a parent, as a partner, and even like noticing your mental health with the people around you, including your family members. It's a general question there.
Yeah, sure, I can go. The mental burden for me definitely is less, like as others have said. Went from, having to carry around lots of medication and having injections every second day to, I went to the once every second week schedule for Hemlibra, and it's been great. Like that, I don't think about it most days. But there is still that, is this a bleed or is this not a bleed situation that is going through my head when I'm doing physical activity and I start getting sore muscles or joints. It's like, do I wait? Do I treat? What do I do? Where it was very easy before to just say, well, I'm going to treat. So the mental burden isn't gone, but it's certainly been reduced for me.
You pretty much said what I was going to say. It was, I think it's great. I think I'm a little bit better, but I think there was this transition where I was, it's kind of going from a severe and having every ache and pain and treating regularly to kind of like a mild. And it's a little bit of a different way that you handle life, and second guessing myself a little bit more. So there was a little bit of a transition, but I think overall it definitely improved for me now that I think I have a better handle on it and understanding what my new reality is.
Yeah, I think with every year that sort of passes, I look more forward, and I think about that hemophiliac legacy almost, that of the joints, and that I go on the bus a lot, and I always remark of the elderly person that hops on the bus with like 5 grocery bags and everything like that, and literally hops on the bus, and I'm just like, oh man, I hope. Like, that would be great. Like, I really want that. And so that's really what I like, especially with the fellows that were up here earlier talking about aging. I really start thinking about what's 50 going to be like? What's 60 going to be like? And then that really sort of, preoccupies me, is like, am I cutting the lawn? Like, that was impressive. I was like, people cutting lawns? And then I go, oh, okay, all right. So like, that's really what I start looking at. That's where my mental focus is being. The ongoing care, or the ongoing idea of hemophilia, I've historically through my life, it's just been a piece. So it's never really been a weight. It's just another thing you kind of go through with, but it's the legacy of it. It's the impact, the kind of the scars that you have that you're going to carry into your elder years.
Thank you. Because, we, in our circle of mostly, I guess, what gets say healthcare providers, we often speak about or talk about hemophilia-free mind and how can we reach, that objective of not, that our patients don't have to think about their hemophilia all day or during their, activities, right? And they are free of that constant thought about their health or their hemophilia. So I don't know, well, you mentioned that a little bit, how much this has gone or dissipated, reduced at least, right, with the different therapies. Maybe it's true a little bit for all of you, even though maybe you, Steve, maybe.
I will say my fear of a zombie apocalypse has gone down. I might actually be able to survive instead of worrying about being one of the first people without factor, but, Like, definitely, yeah.
So, okay.
You just don't want to be the slowest hemophiliac. That's what
I think that's probably safe. That's why I've been exercising.
You gotta keep those joints healthy.
Exactly, that's what I'm saying.
Because you'll be like the distraction will leave you, and the zombies just and you'll be just running. Yeah. So I went dark really fast there. We're okay. We imagine things how we're gonna build a zombie backup kit. Okay.
Okay, maybe we can switch to a more positive kind of conversation. But, do you have, guys, any questions you can also ask? But maybe in the meantime, I wanted to ask you, because we talk a lot about shared decision making, and we often think that we are actually doing it in our clinics. So, but I guess probably that's not that true if you ask to our patients. But in your opinion, maybe both for other patients that are going to, seeing their healthcare providers, or for us as physicians, nurses, physiotherapists, do you have, some suggestions, some, thoughts on how can we do better in this process of shared decision making to find, the right therapy for, the right patient at the right time that really fulfills the need and help living the life that you want to live as much as we can, of course, and that informs you, gives you the the knowledge, the information that you really need to make a choice. Whether you have comments on the patient side, what to what they or you would need to ask or discuss more, or for us as healthcare provider, what you should do differently in your own experience?
Well, I like that you're asking that question. That's a pretty amazing question. What I've had recently, a very novel experience, is that with kids, you start going to family doctors. With elderly parents, you start going to physicians and you start seeing things. And I have to say, without a shadow of a doubt, the hemophiliac medical professionals are so good. You guys are excellent. And it's been difficult. It's been difficult to go into an appointment with my kids at a family doctor, or my parents going through their major health crises that they have when they're in their 70s and 80s, and just be sitting there being like, wait, what? What do you? No, this is not how things go. This is, and really, I think it's sometimes as hemophiliacs, with all of this that's happening, we kind of forget how amazing these teams are. And yeah, I just, on behalf of the patients, I want to say thank you.
Great, thank you.
I think everybody's scared of you. No, I think, some of the earlier talks today, I think you sort of hit the nail on the head, that it's really about individuals and what their priorities, what their goals are. And I think, it's a great thing about the fact that we have all these options, is that there is no one size that fits everybody. Everybody has different goals that they want to achieve, and that may be, again, somebody being very, very active and doing very heavy contact sports versus somebody who may want to travel. So having less frequent infusions spread out is maybe their goal. So I think it's just understanding those goals and coming together and deciding what's best for them and giving them the option. I shouldn't say deciding like you, but collectively deciding.
Sure. I guess, yeah.
Thanks, Davide. Yeah, so first of all, I want to thank the panel for really some inspirational comments. I mean, this is fantastic for us to hear. Thank you for taking the time. It's really important for us to hear these things. This is really a comment, actually not a question. So I think some of you were raising the issue about where we are now, and the landscape is incredible. It's really brilliant compared to 20 years ago, 10 years ago even. But I think it's important to keep in mind that the innovation is continuing. The momentum is still there. So the World Federation for the last 30 years has run a workshop every 18 months for new therapies. The most recent of those was in November of last year, and over 2 days, there were 40 presentations, 40 presentations about new therapies. So this benefit that you've seen and been talking about for the last half an hour or so, I think there's every reason to believe it's going to get even better, even better.
Thank you.
Go ahead, Julia.
I have a question for Dane. What made you choose to do Altuviiio versus emicizumab?
It was just a transition. And I wasn't interested in going and being too aggressive with new therapies. And I had just finished a long-lasting product. I won't talk about it, but it didn't work. And it was, I wanted to try another kick at the can. And it really just fit my lifestyle. I don't have a problem giving myself a shot every week. I'm lucky I have garden hoses for veins. So it just fit my lifestyle. It was my norm. And that's why I chose it.
Thank you. I have one more question. So I've talked to a lot of, throughout my years, talked to a lot of families and also a lot of people who have experienced, they've lived through the tainted blood scandal. And a lot of times when we're presenting new possible therapies to patients and their families, the fear of the unknown prevents them from doing that. I'm just wondering how you guys navigated some of that, or if there were fears about like the what ifs, what if this is that, if that happens again. Yeah, if you have any kind of thoughts about that.
For myself, I think I'm a little bit willing to take higher risks than maybe the average person. And again, nothing ventured, nothing gained, and that just sort of been my outlook. And if you don't try, you'll never know. You'll just stay where you are. So, you know, sometimes you just fearfully have to take that step and just see what happens. So, yeah, that was always my approach.
I can say that I was a nervous wreck the day of my transfusion.
That we're not.
I was. Dr. Iorio came up to me.
3 person holding his hands.
Dr. Iorio came up, he says, "Are you sure you want to do this? You seem a little," and because it's an unknown. I couldn't take it back. There, you know, I mean, I don't want to say that there's a risk of liver cancer because the data hasn't shown that, but there is that risk that was presented. But honestly, I truly felt that my life would be better with it than without. And that's really, I think everybody makes the decision for what they believe will be best for them. And that's whether enrolling in a trial because you want to better the community and the research, or if you physically think it's going to improve your life. I think ultimately it comes down to that.
Thank you.
Okay.
Is the mic on? Yeah. Erica, I'm a nurse practitioner at the pediatric program in Vancouver. Now, you guys are obviously a subset of patients that are engaged to be involved in your health and want to make change, have a lot of positive resilience and growth. We don't have all of our patients like this. We have some patients it's difficult to get into clinic, some patients that are quite angry about their disorder. Being a pediatric treater, I like to try to think of doing things early to create a good mindset of health and wellness in my patients. Do you think there's anything way back that you would give me advice and to kind of plant the seeds to have healthy patients that are engaged in wanting to try new therapies, et cetera?
You mean try to tell a teenager what to do? Because I think you said it as well, you weren't always the best. I can say I probably wasn't the best as a teenager, and there were times that I am regretting saying, you know, I don't really want to treat right now. I don't want to impact.
Yeah, don't get me started about diaries.
Exactly.
But was there a way that you were either counseled or supported, et cetera, in your teen years that made you get out of the teen years in a healthy way?
I am not a child psychologist. And honestly, for me personally, it was just maturity. I think, you know, you can drill home what's best for you, and it's hard, but I think that probably goes to maybe some of the treatment options and discussions, is maybe if you know that they're not going to be compliant, then maybe trying to choose something that will provide longer protection would be better. You're a mother. You tell how you control your child.
Well, I think for us, I think having being very open, and from the time he was young, just talking about his hemophilia and letting him know, explaining it to him, teaching him about it, teaching him what he needs to do from the time he's really young, but also building a really positive relationship with our team was really helpful. And we had an incredible team. Our whole hemophilia team, doctors, nurses, physiotherapists, all of them have been incredibly supportive. So I think he actually, he's fine going to clinic, all of those things are fine. He does have definitely some trauma from his early years that we're working on now, but overall, I think he is learning to understand his hemophilia. I know he is 10 right now, so I know we're hedging on the teen years, so I know there could be a difference when it hits that, but he's quite aware and understands what his hemophilia is. So.
Yeah, I think this is kind of where you have that relationship with the CHS, the chapters, however they break down in their individual provinces. And I know as a kid, there's that sense of community when you get parents able to see hemophiliacs of other generations, when you get hemophiliacs seeing other kids, and you get that sense of community when you're not alone on an island, that there can be modeling there that can happen. So you can have, that's where stuff where you have encouraging your patients to participate in even at Christmas parties. It doesn't have to be an educational symposium. I think that part, in tandem with the hemophilia side, can bring in models that say that show to people like there is a good way of doing this, and here's outcomes, and you can show outcomes at different levels with the person with the bleeding disorder. Like, look, this person comes into clinic, they've achieved these things. They can tell their story of how these things help them. And then those people that are a little leery or adverse to that is, based on fear potentially, that you can sort of alleviate that when they don't feel that they're doing it. They're charting their own path. There's been a lot of paths. There's lots of paths to choose. People have done things different ways. But that if you don't have that, you're only coming in and seeing a nurse, your doctor, that can be daunting.
Please, God.
I'm Marie-Claude, I'm a pediatric provider in Quebec City. I was just wondering if you think we're doing enough to open access to clinical trial. Was it difficult for you to get to the clinical trial that you wanted, or was there other, for example, gene therapy that you would like to have access to where you didn't? And is there anything you have in mind that could be done to broaden access to clinical trials?
I think my hemophilia care team was very open and forward with the advancements and the options. Again, myself, always curious as to what was coming up next or any innovations I was also asking. So for me, I was very fortunate. It was already presented. There was no holding back. So.
Yeah, my impression sometimes it's the trial themselves that are more restrictive than the people implementing the trials. I know the team at MAC was very accommodating, making them come in on a Friday morning before, so I could still get the kids to school and still do my day. I think the teams are doing a great job of working with people, because I think it's just so clear that the ultimate goal is gathering the information, and everyone's on the same page for that.
Please, go
ahead. Hi, Mike Barrett from Newfoundland. I don't actually have a question, but a response or a comment on the last question about young people. I'm a teacher, and I've taught a lot of young people. And you hit a number of important points. You know, the community, they're going to respond more to their peers than their parents or other adults, obviously. The relationship is really key. They're more likely to listen if you have a good relationship. But then ultimately, you can give them the information, and you can try to reason with them, and you can't make a teenager anything. That's just true, and then you have to accept that sometimes they will make the wrong decision. But that does end, and then maturity comes, and so the best you can do is talk to them and hope for the best.
Thank you. Oh, please, probably we are at the last question.
Okay, Don Houston from here. So, I mean, we've gone from good treatment to great treatment, and, you know, we're asymptotically approaching almost perfect treatment, which is fantastic, but most people in the world do not have treatment at all for hemophilia. So which of these things that are fabulous are going to change the global picture of hemophilia rather than just our local picture?
Did you see his algorithm? It's he's still figuring out the algorithm. It's okay. Anyways, I'll see what you guys want to say.
I was going to say, I have spoken to other hemophiliacs in other countries who do not have access to factor. I have been asked to send factor to people, and it breaks my heart. It is one of the things I would really love to see, and I don't know how this will be possible, but hopefully I do think gene therapy could be very, very helpful for some of those remote access issues where they don't even have access to a doctor, let alone factor. And these patients are experiencing, you know, lifelong joint issues. So in that regard, I really hope that this treatment will be available, at least in that capacity to help them. Even though it may not be perfect, there are a lot of caveats with a lot of things, but that's my ultimate goal as well.
Thank you everyone. I would just like to, again, I cannot emphasize enough how much I appreciate you being here and participating in this conversation and also participating in the clinical trial. This is so important for the community at large. So thank you really to all of you, and thank you for being here with us today. And we'll see you later.
Dr. Matino, I think
there's one more question.
Oh, sorry.
Yeah, before you close, just taking from what you said, I'm from one of those countries. I'm from Nigeria, and one of the reasons why I'm in Canada is because I have a son that has hemophilia, and my son will be 8 in August, and we realized that he has hemophilia when he was 18 months. And joining the program, I realized that, okay, so let me start with this. We have like maybe 3-4 adults in the country that has hemophilia to start with. So you can imagine a country that is population of like maybe like 10 million, and we have less than 10 adults with hemophilia. So you can do the math. So you can imagine having a child, and you literally know that this child is not gonna grow hold on you. That scared me to my bone. And I made a mission, like I have to leave this country. That was my life goal for my child. And so I couldn't sit with that comment and not say anything. You know, I was telling people on my table that I'd rather take an expired factor than nothing. Myself had administered expired factors for my child severally, not once, not twice. I know I see it as expired 6 months, but I'd rather use that than nothing. Because, and what we were told, or what I've realized is, it will stop the bleed, but it might not have the expectancy. Maybe it's supposed to stay in the body for like 3 days, but that hour is gonna stop that bleed. You know, the first time that my child was diagnosed, there was no factor. So he had to use FFP, fresh frozen plasma, and he developed an infection after that. And after the bleeding stopped, then we started treating the infection. And I saw my child, vomit blood. And I literally started crying. I felt he was gonna die. And it was such a tiny baby, it was just 18 months. So you can imagine that scare. And so when I joined the foundation, I was very active because I didn't want my child to die. And I think that's why I'm here today, because I was very active, and less than a year that I joined the foundation, I became an ESCO. And we have zero support from the government, zero. So I was also telling them that everything that we do for the country is from personal donations of members that are educated and at least well off. So, and if you're joining the foundation, there's bills to be paid. We don't have steady power supply. So we have to buy a fridge to store the factors. We have to install solar panels. So the factors have a regular temperature they should be installed in. And we get donations from
WFH, yeah.
WFH, yes. And sometimes by the time it gets to the countries, it's already expired, but we'd rather take that, like I said. And we have people that died because they have hemorrhage. We have a 2-year-old that is blind because he fell and there wasn't any treatment at that time. We lost like 5 people during COVID because during the shutdown, we couldn't get supplies, and there was bleeding, and there was nothing we could do, and we lost them. So that is our fate. So I think towards the time, 2023, early 23, we started getting a few vial of Hemlibra. Maybe in a pack of 10, we could have like 10 Hemlibras, vial of Hemlibras, and those were going to people that already have collapsed knee, that they couldn't walk, critical cases of patients. That was what we're dealing with. And there was even nothing like prophylaxis because we have people that are bleeding on the spot. So it was basically on demand, and you can imagine if you have a child that has less than 1% of factor level. That was my case and several others like that. So seeing all this, I just bleed for my country and for the people left behind. And I just pray and hope that it gets better. But I'm glad to be here. This is my first time here. And I think 2 months ago, I was elected as a board in my province, which I'm grateful for. And I just want to put this out there. So we know that whatever we have right now is far more than what other people have, and something that we need to be grateful for. Thank you.
Thank you for sharing that.